COVID-19 keeps spreading in India. The country reported over 320,000 new infections on Tuesday as a third wave finds hospitals in shortage of oxygen and as the country awaits foreign assistance. Drugs and oxygen have seen prices spike on the black market. The World Health Organization said it was working to deliver 4,000 oxygen concentrators to India, where mass gatherings, more contagious variants of the virus, and low vaccination rates have sparked the second major wave of contagion.
Okay, so we have been receiving requests for beds, then plasma, and in some cases medicine. So medicine we do not do because that is mostly done by government. They have been doing a tremendous work handling the medicines part. So we have been receiving bed requests and plasma requests. So bed, what we do is we first coordinate with the COVID, our team member coordinate with the COVID war rooms. And if we do not get any, and even we make call to the hospitals also to find a bed for the patients. And about plasma, the patient that we have helped earlier, what we do is we call them and we ask them to donate plasma for the newer requirement that we are getting.
Ishan Garg joins us now live from New Delhi. Thanks for being with us. Please give us the latest, first of all. How are things looking today? A record number yesterday, 320,000 new infections. Really hard to see the images from India. How's it looking on the ground?
Well, unfortunately, the situation is no better today as well. India's recorded 360,000 cases of COVID-19 in the past 24 hours. This is a jump of 40,000 cases from the record infection yesterday as well. And the death toll has also gone beyond 3,000, which is the largest death tally the country has recorded since the pandemic started. In New Delhi, we are seeing really heart-rending scenes. Cremation grounds are full. People are not able to get access to these places to bury their dead or to burn their dead. There are long lines out of cremation grounds, and several people are now asking the government to clear out forest areas and green areas to make for more firewood that they can use in cremation grounds. In hospital, the situation is bad as well. There are several private hospitals which have sounded the alarm in the past 24 hours, saying that they are about to run out of oxygen in only a matter of hours. At the same time, the government is trying to import more oxygen from separate countries, but as the situation stands right now, there are tens of thousands in the capital city only who are gasping for breath. A new statistic that came out yesterday was that every 4 minutes actually somebody is dying due to COVID-19 only in the capital, and this figure could be much, much higher if extrapolated for the rest of the country.
Now, Ishan, India is often regarded to as the pharmacy of the world. It has a very developed pharmaceutical industry. It has developed its own vaccines that it has also exported elsewhere in the world. Tell us about the rates of vaccination so far within India, and how is that being unrolled? I mean, rolled out. What's happening? What's preventing those vaccines from reaching the citizens?
Well, you've put the finger on it. India is a pharmaceutical giant. It produces about 2 billion vaccines every single year. It vaccinates about 20% of the population from the stock that is created from the country. But there are several bottlenecks from producing a vaccine to actually getting the shot in the arms of the people. Now, there are several pharmaceutical companies with massive capacities to build vaccines, but only 2 vaccine makers are currently making vaccines in the country. There's the Serum Institute, which is making the Oxford AstraZeneca jab, and there's Bharat Biotech, which is making the one vaccine you pointed out, the locally developed Covaxin. Now, India planned to inoculate about 300 million people by August, but the vaccination rate is incredibly low. Of the 300 million people, only 20 million people have got both their doses. 100 million people have got a single dose of the vaccine, and both the vaccines being used in the country are only effective if people have got 2 doses. So the vaccination is not going according to plan, and to make things worse, the government is now opening up vaccination for almost all adults in the country. That's about 1 billion people who will become eligible to take a shot from May 1. And the demand is going to outstrip supply by a massive margin. To remedy this, the government has allocated more than $500 million to increase the production of vaccines in the country, and it's also trying to import more. But only time
Ishan,
will tell if
sadly, we're out of time. Thank you very much for that input from New Delhi, and of course, we're hoping